As suicide rates rise across the general U.S. population, they are rising even much faster with respect to the veteran population. The CDC says that over 42,000 people committed suicide in 2014, and of those, at least 20 suicides a day were veterans. The VA says the risk for suicide is in fact 22% higher in veterans compared to the general United States population. Here with me now to discuss that and other things at the VA, Veterans Affairs Secretary David Shulkin. Secretary Shulkin, thank you very much for joining the show.
Glad to be here, Charles.
I know when you took the job, you said that suicide prevention was your top clinical priority. Give us an assessment of how things are going.
Well, it remains our top clinical priority. The number of 20 veterans taking their life every day is completely unacceptable. And what we're doing is we're focusing all of our efforts to get that number down. We're working with community partners. We're working to find new ways to address the treatment to make sure that we get that rate down very quickly.
One of the things I noticed, I looked at the last report issued by the VA on this, and it jumped right out at me is the suicide rise among female veterans. In 2006, it was 9,000 per 100,000 persons. In 2014, almost doubled to 17%. Is there some underlying reason for this huge surge amongst women who have served our nation?
Well, what we know about the women that have served the nation is that those that are getting care in the VA system have actually seen a decrease in their suicide rate over the past 14, 15 years we've been looking at this. But those women that are out and haven't been getting care in the VA healthcare system are actually seeing a dramatic increase, a 98% increase over the last 15 years. So what we're trying to do is to make sure that women are getting the right type of mental health services and getting help where they need the help.
How do you get the word out there? I think everyone watching, certainly, we have a lot of vets who watch the show, and a lot of people who watch have people in their family who served in the armed forces. And yet it feels like the message, it's really tough to get the message out there.
Well, we can't do it alone, and we know that at VA. So we're working with our community partners, our veteran service organizations, our nonprofit organizations, our churches, and our community groups. We're also about to release a public service announcement that Tom Hanks has actually done for us to be able to get the word out to a broader audience.
Recently, there's been some criticism of the Veterans Affairs saying that they've actually helped to fuel the opioid crisis that's killing thousands of veterans, and it goes on to complain about the relationship with Purdue Pharmaceutical. Obviously, opioids and veterans are a major problem. Of course, it's a major problem for everyone. What do you make, though, of this, of some of the criticism being leveled at your agency?
Well, I think the data suggests that VA started to address this issue well before most other organizations in the United States. We started to focus on opioid reduction in 2010, and since then we've seen a 36% reduction in the use of opioids among veterans. And what we're finding is that the ways that we're addressing this issue are being replicated by other healthcare organizations around the country. Our goal is to make sure that veterans get adequate pain relief, but look towards opioids only after they've exhausted other options and used other substitutes for treatment.
Sir, I know you have a very close relationship with President Trump, and of course his war, if you will, with the media is well documented. Does that harm your efforts in any way across the board and the things that you're trying to achieve?
I don't think so. I think that both the President and I want to be able to get the message out that is accurate and represents a clear picture. The only way I know how to do that is to be able to go out and talk to groups and to talk to audiences like yours and to be available to answer questions that are posed. And I think that the President understands that part of our responsibility to serve veterans is to get our message out in a clear and accurate fashion.